Death is a very painful and emotional time, regardless of your colour, race or religion, especially when you lose someone you love so dearly. Muslims strive to bury the deceased as soon as possible after death. With a growing Muslim population across the UK and the West Midlands, Heart of Birmingham Primary Care Trust has been working with the members of the community on developing a rapid release policy, which is about encouraging the medical practitioners to sign paperwork promptly so members of the families can organise funerals quickly. For years, members of the community experienced difficulty in having the bodies released after death. The policy was prompted by members of the community who lobbied the Heart of Birmingham Primary Care Trust as a service provider to deliver and meet the needs of the growing population under the law, and has been out on consultation and was presented at Cars Lane Church to get final views, opinions and to have face-to-face dialogue with various members of the community and health officials. Once completed, this will be the first rapid release policy of its kind and can be applied to the other parts of the UK through local PCTs. Dr Sandy Bradbrook, Chief Executive, Heart of Birmingham PCT.
In Birmingham, we have many people from a Muslim faith, from a Jewish faith, and indeed some of no faith, where it is part of their religion that they want to try and bury their deceased within some 24 hours, which is really quite quick as far as the traditional British people are aware. And this has caused great difficulties for these members of our society. And of course that's very significant for us in Heart of Birmingham, given all the numbers we've got. And a number of people approached us in Heart of Birmingham to say, could we actually do something about it? Because they were experiencing some delays, either with the doctors or indeed with the coroner. And the coroner, of course, doesn't have huge resources behind him. So what my staff have done is worked with the local people. We've worked with one of our GPs who's got a particular interest in this area, and we've developed some new policies and new guidelines, some little rules of the game, if you like, whereby people can actually try and get the bodies of the deceased released in the sort of time that they would like. But we have to make sure it accords with the law of the land. And there lies the difficulties. But I'm pleased to say that we've gone a long, long way. We've prepared a document already. It's been out for one level of consultation. It's been refined. And tonight is a very, very important event because we have a lot of people here, and this is an open consultation, both with the members of the Primary Care Trust who've helped develop the policy. Some of the members of the public have also been involved developing that policy, and Mr. Aidan Cotter, the coroner, as well. So we hope that as a result of tonight and the feedback we get, we will make yet further refinements to the policy, but then we'll be able to conclude it and try and get it into the system, can train our doctors. Aidan Cotter at the coroner's office can try and make sure he can respond as well, and hopefully then all members of our society, when things are done properly, can then actually fulfill their own obligations to their family members who sadly died. So I hope tonight will fulfill all those objectives.
Dr. Abdul Hafeez is one of the community members who helped develop this policy. In his presentation, he said, like the Christians and Judaism, Muslims believe that death is a departure from the life of this world, but not the end of the person's existence. The rapid release policy has set out clear-cut aims and objectives which will act as guidelines not just for the medical staff but also to the bereaved families about the processes that must be followed, and highlights that certain religions, in particular Islam and Judaism, require funerals to take place as soon as possible after death, subject to the laws of the country in which the death occurs, and in some cases the funeral will happen in another country even though this means considerable delay in burial after death, therefore requiring the arrangements for air transport. Coroner Dr Aidan Cotter points out some of the difficulties faced by his staff.
It is average for 5 different family members to ring us up about each death. 5 times my officers have to go through the same conversation. Each time they have to do it thoroughly. They cannot just say, I've already told a family member, go and talk to him. Okay, that's rude. They're not allowed to do it. They have to go right from the beginning. 5 is the average. Work out for yourselves why we're overwhelmed. One day we had 43 phone calls relating to the same death in one morning. 43. Can you tell me the sense in that? Can you wonder if we get exasperated? Can you wonder if we get annoyed when people say your phones are always busy? Now, if you could just get that one point across, tonight has been worthwhile.
In the questions and answer section, some members pointed out that this was long overdue. However, the rapid release policy was warmly welcomed by all present and stimulated a healthy debate where questions and suggestions were put to the panel. Mushtaq Hussain, Town Centre Manager, Washford Heath.
This has actually helped to eradicate some of the preconceived ideas and perceptions I had about the coroner and and it's actually given me an idea of how difficult it is for that person and how that person is reasonable, flexible and kind of understands the issues that we face and how he or she is working with us to help us address those issues.
Zulfikar Hussain, Small Heath Community Forum and ex-non-executive board member Hub PCT.
While the working group have spent nearly 14 months going through the draft documents and initially consulting with the local hospitals, bereavement departments and also the coroner office, registrar office. So we have done preliminary work and now we're for the public consultation.
Maz Dad, Constituency Operation Manager, Fleet and Waste.
Fact of the matter is that despite living in 2010, 21st century, in a modern city like Birmingham, people are still finding that when a loved one passes away, there's a huge amount of bureaucracy and actually no protocols in place to actually get the deceased released so that speedy burial can take place. So all we're trying to do is put an emphasis on all service providers to basically say, look, this is a matter of urgency for Muslim communities as well as other communities that live and reside in Birmingham. And what we want is a service that is fulfilling or adequate for this community. And in this case, obviously one of the saddest times in life for a family or next of kin, all we're trying to do here is to speed up the process so that the burial can take place as quickly as possible.
Councillor Ayub Khan.
Actually, community leaders have come along to listen to how the coroner operates his office and how the PCT can assist in further improving in the service which is currently being delivered. But I also believe that the City Council has got a very key role to play here, and myself along with Councillor Zakir Chowdhury, we have asked for a review into the whole approach when somebody dies. What is the beginning and what is the end? Where do the families turn to? At this moment in time, they have to face the coroner, they have to resolve issues within with the undertaker, with the registration office, with general practitioners and hospitals. And I think as a council, we need to be looking at best practices and we need to be looking at a holistic service so you have a single point of contact, and then from there onwards, the service providers take control and they, whether it's a GP service, whether it's the death registration office, whether it's the coroner's office, that we all work in partnership and make this process as easy and as efficient as possible for the family of that deceased. In a time of hard, we should be there to support that deceased individual's family.
Ahmed Qazi, Birmingham Jamia Mosque.
The event is very good. The PCT has done finally something good to get the community together and try and improve the facilities that Muslims have been looking for a very, very long time. Jamia Masjid has been with the ex-Saddam Hussein Mosque has been involved in this particular practice from the early 70s, and today we can see some fruit that has been achieved from the first achievements in 1970s.